Imagine walking into a doctor's office where the only human in the room is you. Or better yet, you can talk to the most knowledgeable provider in the world, 100% evidence-based and free of human bias, right from your home at a lower cost. Is this the next level of medicine? We are going to objectively explore how advances in artificial intelligence could fundamentally transform healthcare forever. And this is my unbiased take. Trust me. You know, we have a very romantic view of medicine and how humane it is or should be. But in practice, medicine is extremely structured and algorithmic. Most encounters are very common problems with very well-mapped pathways or guidelines to follow. You input the vital signs, lab values, signs and symptoms, which by the way, we call semiology or semiotics. A flow chart is going to guide you on what to do next. For things that we see every day, in primary care, for example, we have these steps memorized. For more complicated and uncommon things, we must check online or discuss with our colleagues. But as a healthcare provider, of course, we not only know where to look for the information, but how to interpret it because of our background knowledge. But why do we follow these diagrams instead of thinking it through and coming up with our own plans according to everything that we have studied in the past? You see, when we think about thousands of cases, following the structured rules will outperform a clinician's intuition. Oh, whoa, oh! How? The whole point of algorithms and checklists in every profession or activity is to reduce missed steps and reduce variation. We have, for example, studies from over 20 years ago showing that mechanical predictions of human behaviors are equal or superior to clinical prediction methods for a wide range of circumstances. And this is from a time where we would only talk about AI if we were talking about the Matrix or something. This was even before Google had records for its own searches. And clinicians don't always follow guidelines. In primary care, non-adherence to guidelines can be surprisingly high, which leads to unnecessary costs and suboptimal care in many cases. To show you how important this is, when a safety guideline was introduced for non-cardiac surgeries in 8 cities, different cities around the world, the risk of dying dropped by almost 50%. But do you know who can strictly follow guidelines and not let emotions take over? A computer. You probably said AI, but that's fine too. Even if we can't really trust it with our lives today, just compare where we are with AI to where we were 3 or 5 years ago. There are some cases, of course, when we don't have strong enough evidence to develop guidelines, and that's when the specialist's knowledge and experience are important and what AI can't replicate yet. A doctor's intuition comes from 2 places: knowledge and lived experiences. For a machine, knowledge is the easy part, of course. A model can ingest more books and peer-reviewed articles in a day than I could in my lifetime. What we call intuition is much trickier because our hunches are really based on compressed experiences. We've seen patterns before. For example, a patient's hesitation when answering a question, shallow respiratory pattern, posture that doesn't quite fit, and things that we can't always explain, but our brains are extremely good in recognizing these patterns. Sometimes, however, they can deceive us. And now the question is, can AI learn those patterns too? Maybe not perfectly today, but the answer is yes. When we turn our human senses into signals, for example, video, audio waves, algorithms can be trained on far more examples than any single clinician could see in their whole career. Medicine is moment by moment, vision, hearing, and touch. Sometimes smell, which is not my favorite, and never tasting. Inspection, auscultation, palpation, percussion. If we can record those signals ethically, that's an important word, we can train models to recognize patterns with superhuman consistency and prediction. Intuition is learnable, and anything learnable from data is scalable with AI. And the amazing part is that in case of a computer, all of these data is cumulative. They just build on top of it more and more, whereas every new physician needs to start from zero to have a good gut feeling one day. If we can tackle the limitations like cost of a large-scale project like this, privacy and safety protocols, which I believe we will, medicine in a few years is going to be unrecognizable compared to what it is today. You know, there was a saying in med school in Brazil that the physical exam is sovereign. In the US, we hear similar phrases such as physical exam is paramount or treat the patient, not the test. And here is when we go back again to a more romantic and traditional view of medicine. However, for many problems, modern tests outperform our senses. When we think about shortness of breath, for example, knowing how to listen for crackles, percuss, for dullness, or watch the breathing pattern are all very powerful skills, don't get me wrong. They do make you feel like a real doctor. If this patient has pleural effusion, which is fluid around the lungs, listening with a stethoscope is almost half as good as a point-of-care ultrasound. Knowing that, as a patient, which one would you prefer? And what about surgery and procedures? Robots are already performing very precise and repetitive tasks. And again, the same things that a surgeon is trained on, like anatomy, the individual variations, and of course, all of the pathologies. The machine can quickly learn them too, especially with modern cameras able to determine depth. Even our iPhone can do that nowadays. The future where many surgeries will be performed exclusively by robots, I don't think it's that far away. But from being available and existing to being available everywhere is a completely different story. Because even much simpler things like reading an EKG are still done manually in many hospitals and clinics and urgent cares and etc. And we've had the technology for many years to have a machine precisely read with greater accuracy than humans, but it's still not broadly available, even to this day. It's funny how we like to think physicians make purely rational choices, and we forget that even the more experienced doctors are still human beings, and their decisions are shaped by many variables, including time of the day, fatigue, stress, emotions, their beliefs even. A very good example is how at the beginning of a shift or a beginning of the day, we tend to order more tests compared to the last hour of the shift. That's decision fatigue. Or when a patient gets us upset for whatever reason, our diagnostic reasoning can unintentionally slip. So you probably already know where I'm going with this. But here's the caution. Machine learning learns from data. If those data have encoded biases and inequities, the machine too can be biased. Does that make sense? So for now, there are many people working on all of these things to try and prevent them from happening, but very soon we will reach a large-scale system that consistently outperforms human physicians on most activities. And many people don't know that in medicine, there is something called the principles of ethics. I'm gonna focus on two of them, which is beneficence and non-maleficence. And they translate into maximizing benefits and minimizing harm. This is how medicine works. If we have enough proof that a medication or a system is better and safer than the alternative, and of course, we have the resources to use it. If we don't, it doesn't matter. We are ethically obligated to use it. Right? Think about a clinical lab. An analyzer scans your red blood cells slides and generates counts and looks for weird cells completely automatically. It is already like that. If the machine is unsure, a lab tech reviews the smear. And if the tech still isn't sure, it goes to a pathologist. And if the pathologist is still in doubt, the slide goes to a consensus board with a lot of pathologists and residents and students and a lot of people. Is AI really going to replace doctors like a movie villain or whatever? I don't think so. Just like the leap we had from stethoscopes to MRIs to gene therapy, AI is another tool in our toolbox. A doctor's day-to-day activities are always changing and will continue to change, in my opinion, right now, to a more programming adjacent world. More than ever, doctors need to be very tech savvy and probably will need to learn programming a little more in depth in the future. So for straightforward cases, they shouldn't be a problem for the computer. When things get weird or more complicated, humans can help or even take over, but always assisted by AI and other tools. The health system is going to change how many doctors we need in each setting, and that's actually very good news in a world with healthcare worker shortages. What really matters is that patients get safer, faster, more equitable, and consistent care. How we practice medicine will continue to evolve forever.